Doctors say many adults over 75 ignore these symptoms for months before realizing something more serious was happening. Some of these signs may seem small at first: a little fatigue, trouble sleeping, slight balance issues, or forgetting simple things once in a while. But after age 75, certain symptoms can sometimes signal deeper health problems that many older adults and even families tend to overlook. One of the most overlooked symptoms after age 75 is sudden weakness in the legs. Many older adults notice their legs feeling heavier, shakier, or less stable while walking, but assume it's simply aging. In some cases, however, leg weakness can be connected to muscle loss, poor circulation, nerve problems, or other underlying health conditions. When walking starts feeling noticeably harder than before, it's important to pay attention. Muscle weakness can also increase the risk of falls, which can become very dangerous for seniors. That's why doctors recommend paying close attention to any major changes in strength, balance, or mobility. 2. Another warning sign is feeling unusually tired. After simple daily activities, if short walks, light chores, or climbing a few stairs suddenly feel exhausting, it may be more than normal aging. Ongoing fatigue can sometimes be linked to poor sleep, dehydration, anemia, heart conditions, or nutritional deficiencies. Many older adults slowly adjust to feeling tired every day without realizing something deeper may be contributing to it. When energy levels noticeably decline for weeks or months, it's important to speak with a healthcare professional and look for possible underlying causes. 3. A major change in appetite is another symptom. Doctors often watch closely. Many seniors slowly begin eating less without realizing how much their food intake has changed. Over time, this can lead to weight loss, weakness, lower energy levels, and reduced immune function in older adults. Poor nutrition can also increase the risk of muscle loss and slower recovery from illness. Even small appetite changes that continue over time should not be ignored, especially if they come with noticeable weight loss. 4. Memory problems can also become concerning when they happen more frequently. Forgetting small details occasionally is common, but regularly forgetting recent conversations, getting confused in familiar places, or struggling with routine tasks may need medical attention. Sometimes these changes are related to stress medications, poor sleep, or vitamin deficiencies, while in other cases, they may point to more serious cognitive conditions. Early evaluation can help families better understand what's happened and explore possible treatment or support options sooner. 5. Sleep problems are another issue. Many older adults dismiss waking up repeatedly during the night, struggling to fall asleep, or feeling exhausted during the day can affect both physical and mental health. Poor sleep may sometimes be related to medications, stress, breathing problems, or other medical conditions. Over time, inadequate sleep can also affect memory, mood, concentration, and overall energy levels. Many seniors accept poor sleep as normal aging, but ongoing sleep problems still deserve proper medical attention. 6. Persistent pain that never fully goes away should also be carefully monitored. Ongoing back pain, knee pain, hip discomfort, or joint stiffness can slowly reduce mobility and independence. While some pain becomes more common with age, worsening or long-lasting pain still deserves medical evaluation. Chronic pain can also affect sleep, appetite, mental health, and physical activity levels. In many cases, proper treatment, exercise, or physical therapy may help improve comfort and quality of life. 7. Difficulty standing up from a chair or getting out of bed can sometimes be a sign of declining muscle strength. If this becomes more noticeable over time, it may increase the risk of falls and loss of independence. 8. Shortness of breath during light activity is another symptom that shouldn't be ignored. Feeling winded after simple tasks or short walks may sometimes be related to heart or lung problems. 9. Changes in mood or personality can also signal underlying health concerns. Some older adults become more withdrawn, lose interest in hobbies, or seem unusually sad or irritable. Emotional changes like these can sometimes be connected to loneliness, chronic pain medication, side effects, or depression. In some cases, family members notice the changes before the older adult does. Because emotional health strongly affects physical health, these symptoms should never be dismissed. 10. Weakness in the hands or arms is another symptom families often overlook. Struggling to grip objects, dropping things more frequently, or having trouble opening containers may sometimes point to nerve issues, arthritis, muscle loss, or circulation problems. Many older adults adapt to these changes slowly, without realizing how much strength they've lost. But when hand or arm weakness starts interfering with daily life, it's important to discuss it with a healthcare provider. 11. Frequent dizziness, when standing up, should also be monitored carefully. It can increase the risk of dangerous falls and injuries. 12. Another warning sign is taking much longer to recover from minor illnesses. Slower recovery may sometimes suggest reduced strength or other underlying health issues. 13. Vision and hearing changes can affect safety, confidence, and overall quality of life. Difficulty hearing conversations or seeing clearly may also increase isolation and fall risk. 14. Many older adults become far less physically active. Over time, long periods of inactivity can weaken muscles faster and make everyday tasks much harder to perform. 15. And finally, one of the biggest mistakes is assuming every symptom is simply old age. While aging naturally changes the body, ongoing or worsening symptoms should still be discussed with a healthcare professional. Another symptom many older adults overlook is swelling in the feet, ankles, or lower legs. Some people assume it's harmless or simply caused by getting older, but persistent swelling can sometimes be linked to circulation problems, heart conditions, kidney issues, or certain medications. If swelling becomes frequent, painful, or suddenly worsens, it's important to seek medical advice. Ignoring it for too long may allow underlying health problems to become more serious over time. 17. Frequent confusion about medications is another major warning sign. After age 75, many older adults take multiple prescriptions every day and accidentally missing doses. Taking the wrong medication or forgetting whether medicine was already taken can sometimes create dangerous health risks. Medication confusion may also point to memory changes, vision problems, or difficulty managing daily routines independently. Doctors often recommend regular medication reviews to help reduce these risks and improve safety. 18. Another serious symptom that often gets overlooked is sudden weight loss without trying. Losing weight unintentionally may sometimes be connected to poor nutrition, digestive problems, medication side effects, depression, infections, or other underlying illnesses. In older adults, even a small amount of rapid weight loss can weaken the body significantly over time. That's why unexplained weight changes should always be taken seriously and discussed with a healthcare professional. Getting older is normal, but ignoring warning signs paying attention to these symptoms early may help older adults stay healthier, safer, and independent for longer.